multiple choice vergence, and jump duction therapy.
One of the most important therapeutic programs in the VTS utilizes targets presented in an operant conditioning paradigm where the patient makes a response to the position of a stereo target. When the patient makes an appropriate response, the vergence demand is increased. When they make an inappropriate response, the vergence demand is decreased. Their response guides the therapy. We're going to be using the multiple choice targets in a random dot stereogram. Random dot stereograms have the advantage that the only way that you can perceive them or see them is if you're binocular or bifoveal at the time that you're viewing the target. Kelly, what do you see?
A red square with another little red square inside of it.
It's either top, bottom, left, or right. Where is it?
Bottom.
Okay, make a response where it is. Kelly just made a correct response and we hear a beep. When Kelly's looking at that, she's seeing a group of dots, and in there is another group of dots with the shape of a square popping out or coming closer to her. She can only see this if both eyes are working properly. Therefore, it's impossible to make correct responses on the basis of guessing. When we change the size of the target, that information is stored in the patient's data file and then can be printed out afterwards. We started with multiple choice vergence, and now we're doing a jump duction. That can be done either auto or random. In the auto, it progresses so that every time she makes a response, it increases both the base out or base in vergence demand, or it can be done randomly where it's unpredictable what the vergence demand will be.
This is a lot harder.
Kelly, since you're having a little bit of trouble with this smaller target, we're going to make it larger. That should make it easier. Kelly is controlling the responses of this particular technique. The faster she does it, the quicker it goes on, the harder the vergence demand becomes.
I feel like my eyes are adjusting all the time to try to see it clearly.
And they are.
Yeah. But once I focus on it, it's very clear to me that it's coming out towards me. And sometimes it blends right in with the box, and sometimes it's sitting way out in front towards me.
It's getting harder because we're increasing the vergence demand. Kelly's really working her eyes at this particular point.
I feel like I'm cross-eyed.
We've reached the limit of her fusion ability. She's now making mistakes to bring the targets back together. When she finally refuses, that will be the recovery.
Okay, that's a relief.
You got it?
Yeah.
Great. These techniques can also be done with regular stereoscopic targets. And frog is an example where there are numbers 1, 2, 3, and 4. Only one of the numbers is popping out. Kelly, make a response to the number that's popping out. And the task is similar to that of a random dot stereogram, except using a stereoscopic target that has contour to it.
Oh, that's a little tough because I feel like the frog is coming toward me.
You're doing a great job.
The VTS Vision Training System.